Good afternoon. My name is Janie Gordon, and I'm the Program Administrator of the Mid-Atlantic Public Health Training Center. And on behalf of the Training Center and the Maryland Department of Health and Mental Hygiene, I'd like to welcome everyone to today's presentation, our June Public Health Practice Grand Rounds on college drinking in Maryland, what's happening and what works. I have a few announcements before we get started. For people who are watching online, please check out our archive Grand Rounds and other online trainings. Our next Grand Rounds on July 17th will address childhood immunizations. Be sure to mark your calendar. For those watching online, you can email a question for today's presenters by simply clicking on the link. With that, we're ready for our presentation on college drinking in Maryland, what's happening and what works. I'd like to introduce today's speaker. We're really delighted to have Molly Mitchell. Molly is the Senior Alcohol Policy Program Manager with the Center on Alcohol, Marketing, and Youth, CAMI, at the Johns Hopkins Bloomberg School of Public Health. She joined CAMI in August 2012 to manage the Maryland Collaborative to reduce college drinking and related problems. She previously managed our very own Mid-Atlantic Public Health Training Center here at the Bloomberg School of Public Health and has consulted for local nonprofit organizations on fundraising and substance abuse prevention. Ms. Mitchell coordinated Maryland's Enforcing the Underage Drinking Laws program in the Governor's Office of Crime and Prevention. She's a member of the Maryland Bar Association. We also have joining us today via phone Jesse Ketterman, PhD. Dr. Ketterman is the Assistant Vice President of Student Services, Dean of Students at Frostburg State University. He has been working with alcohol-related issues for 17 years. With the leadership of Frostburg President Gibraltar, Dr. Kellerman has implemented several initiatives addressing high-risk consumption at Frostburg State University. He is a member of the Association for Student Conduct Administrators, serving as treasurer, the American College Personnel Association, and the National Association of Student Personnel Administrators. In 2010, he was recognized by this group as the Mid-Level Professional of the Year. He has presented nationally on addressing alcohol-related issues both on and off campus and has written articles on due process in student conduct systems. Dr. Ketterman earned a Bachelor of Science in Business from West Virginia Wesleyan College, a Master's of Business Administration and a Master's of Education from Frostburg State University, and a PhD in Educational Leadership from Touro University International. In addition, Dr. Ketterman served in the United States Army Reserve, graduating from the Military Police Basic Training School in Fort McClellan, Alabama. Post-September 11, he served on active duty under Operation Noble Eagle. With that, I'll turn the program over to Molly Mitchell.
Thank you, Janie, and thank you all for coming today. I'm really looking forward to talking today about the Maryland Collaborative to reduce college drinking and related problems. First, I want to just talk a little bit about the problem of college drinking, why it is a public health problem, what can be done, what the research shows can be effective, and what we're doing here in Maryland to work with colleges to reduce the problem of college drinking. And then we're going to hear from Dr. Ketterman, who's going to talk from Frostburg State University about their success in reducing college drinking at Frostburg. So first, understanding the problem of college drinking. A lot of times people will hear about college drinking and think it's just a rite of passage, everybody goes to college, they drink. We want to talk a bit about why it is a public health problem. This is just an annual national snapshot of the problem related to college drinking. 1,825 alcohol-related deaths, unintentional injuries, assaults, sexual assaults, and date rape, alcohol-related health problems, students having unprotected sex, students driving under the influence of alcohol, These are all related to college drinking. College drinking also shows that 25% of students report an alcohol-related academic problem, and that includes students having problems missing classes, students falling behind, students dropping out of a major that they may have started in to switch to a major that's a little less demanding, student drinkers reporting damaging property while under the influence, and students meeting criteria for alcohol abuse or dependence. On average, students in college drink more than their non-college attending peers. As you can see from this graph, that's been pretty constant over time. Alcohol use is also associated with short and long-term academic difficulties during college. And this graph just shows that this progresses over time. Students will start skipping class, they'll start studying less, have cognitive problems, and then that can become declining GPAs, dropping classes, lost opportunities such as work study, internships, and then long-term outcomes as well, and delayed graduation, failure to graduate, attenuated goals, and lack of readiness for employment. Alcohol consumption affects brain development. One thing that we've learned from neuroscience over the last years is that the brain continues to develop all the way up to the age of 25. So as students drink, alcohol has an effect on the development of their brain. So students who are heavy drinkers during this really important age of 18 to 25 are having impairments of the development of their brain. And that can have long-term difficulties as well. Younger individuals are also more vulnerable to the adverse neurobiological effects of alcohol use. So when they are drinking, it has a different impact on their brain. It's going to affect the development of their cerebral cortex and also parts of the brain that are associated with learning and memory. A substantial proportion of first-year students come to campus as heavy drinkers. So this is one of the challenges that we learned a lot from colleges as we talked to colleges throughout the state this year, is that many students come to college already with a heavy habit of drinking in place. This just shows the increase in the annual prevalence of alcohol use, abuse, and dependence among college life study participants by age. And you can see as they increase in age throughout college, there is an increasing rate of alcohol abuse from alcohol dependency. A lot of the problems we've talked about so far are really related to individual students and the problems that they have related to drinking. There are a lot of community level problems as well. Noise, nuisance, vandalism, student safety, healthcare costs, law enforcement costs, town-gown relationships, violence, drinking and driving. So now I'm going to talk a little bit about the Maryland Collaborative. This is the first year of the Maryland Collaborative. We were funded this year with seed funding from the Maryland Department of Health and Mental Hygiene. We are funded here at the Johns Hopkins Bloomberg School of Public Health, as well as our partners at the University of Maryland College Park. This year, we have been very active, going around and talking with all the different colleges and universities in Maryland. We were really listening to them about what is the nature and extent of college in Maryland, and learning about what they have seen in their colleges, what they're doing to address the problem, and how we as a collaborative statewide can help. We have put together a guide to best practices. So we've done a research of all the literature on what's effective to reduce college drinking, and we'll be coming out with a guide this summer looking at all of that research, addressing both individual level interventions as well as environmental interventions. And this will be a resource that colleges will have online. They'll be able to access it, and it will have links to other resources online as well. We put on a statewide conference in May. We had about 250 people come from all different colleges around the state, and we brought in national presenters and experts who were able to talk about what are the evidence-based practices that colleges can implement to reduce college drinking. We have put together a governance council of college presidents. So right now we have 10 college presidents who have stepped up to say they want to be part of this collaborative with us. We have college presidents from 4 USM schools as well as private colleges throughout the state. And we've done an assessment of and a report on the college drinking in Maryland. So I'm going to talk a little bit about that assessment. We were able to go out and talk with 38 colleges in Maryland. We started to reach out first to the Vice President of Student Affairs. And we started out first with an informal interview to find out what is the nature and extent of the problem at the college. What are some of the community level, what are some of the different community level interventions that they're involved with? What are some of the problems that they see in the community and on the campus? And we talked with people in the community coalitions as well. So there are a number of colleges in Maryland who are working with community coalitions to address college drinking in their communities. And so we met with people from those coalitions, including law enforcement, people from the local liquor boards, people from the local health departments. The assessment also included looking at a comparison of college attending versus non-college attending peers in Maryland, web-based search on alcohol-related campus policies, a review of administrative data, and looking at a total of 42 Maryland colleges and universities. And so this is what we found out what's happening in Maryland right now. This really, this is a list of some of the problems that colleges told us they see related to drinking on their campuses. And this reflects, again, some of the same problems that we see nationally: assaults and injuries, unsafe sex, DUIs, sexual assaults, drug use, lower grades, fights, overcrowded parties. We've learned from the colleges in Maryland, every residential college in Maryland is addressing college drinking. And most non-residential colleges in Maryland acknowledge that even though they don't see the problem so much on their campuses, they do know that the problem is probably out there, but they just don't have the data to know the extent of the problem for their students. So these are just some general findings. Most colleges in Maryland are working in a workforce with their campus or in their community. Some of the evidence-based practices are used, but they're used somewhat inconsistently. The desire exists among colleges to learn more and to improve existing programs and approaches. And we've identified some training gaps, and we're looking at the methods being used to measure alcohol use and the related problems, and they really vary very widely. So this just shows a little bit of the information we were able to get from 4 colleges were able to give us information on the extent of alcohol use on their campuses. This is the number of schools that are showing the kind of data that they're able to collect. Again, this is one of the things that we really hope to work on this year, is improving data collection among Maryland colleges. Right now, they don't have the resources, a lot of colleges, to collect the data that they need to really assess how effective their interventions are and what the extent of the problem is. And this is just, again, from some of the assessments. When a student is identified, are evidence-based interventions available? And you can see that it's somewhat inconsistent at this point. Parent involvement is another approach that we're hoping that colleges will really focus on more. And right now that is being used in some colleges, are really involving parents in making sure that there's a clear message to their students, and others are not doing it as much. We also talk to colleges not just about what they're doing on their campuses, but also their involvement in community-related interventions. And this chart, I know, is really hard to read, but you can just see from the bars that it's very inconsistent. There are a lot of good programs happening and some best practices on campuses, but it's inconsistent across the state. And again, we asked whether they were prohibiting campus media from accepting alcohol ads. And that's more for 4-year colleges, less so for 2-year colleges. Although we did see that a lot of 2-year colleges have dry campuses. And so some of these policies are not pertinent to them. So we also asked whether they work with law enforcement to conduct compliance checks. This was another best practice. There are colleges working on that with their community. We hope to see more of that this year. So these are more charts showing, again, that some of the strategies to work with the community on advocacy groups to increase excise or sales taxes or eliminate the practice of drink specials is inconsistent in Maryland. And again, this looks at the number of colleges that are involved with mandatory responsible beverage service training in their community. And some colleges are involved and others aren't. We talked a lot to colleges about what are some of the challenges that they see in addressing this problem in the state. And one big problem that we saw is expectations. And this is something we heard over and over and over again from colleges, that students come to college with an expectation that they're going to get to college and that drinking is going to be a big part of that culture, and that this is going to be their time to drink heavily, and that's expected, and any attempt to infringe that is going to be an infringement on their rights. There's also another expectation that we want to address, and that's the expectation that they have that drinking is going to actually be a social lubricant, that by drinking they're going to be more comfortable in social situations. A lot of studies have shown that that is actually not the case, that there's a huge placebo effect with alcohol. So when students are given a drink that they believe has alcohol in it, they're shown to have the same kind of relaxation and social lack of inhibitions that you might expect from somebody who's drinking. But they don't have, of course, the more extreme problems that people have with drinking, of falling over and all the other list of problems that we saw earlier. Events are another challenge for colleges because colleges have a lot of traditions around events where people have a tradition of having alcohol served, for example, at tailgating events. And there are different times of the year when alcohol and drinking seems to be more of a problem. We heard that happens more around tailgating, around Halloween, around the very beginning of the fall semester, as well as the end of the spring, when a lot of people are coming out, it's warm out, and there are a lot of traditional college events happening on campus. Parents are they're here as a challenge, they're also an incredible opportunity. Right now, parents are not really confused about what kind of message they should be giving to their students about drinking. A lot of parents believe falsely that if they give their students the message that they should not be drinking, that will have the opposite effect of the student wanting to drink even more. But the research shows that's not the case. If parents are able to talk to their students before they come to college about their expectations, have a warm relationship with their student, give them clear, firm message that alcohol is not expected to be a part of their college experience, it's shown to have a big impact in reducing the incidence of drinking and all the alcohol-related problems. Some more challenges are financial. This is something that colleges really struggle with because collecting the data, we saw that just collecting the data to know the extent of the problem takes resources. And there are institutional struggles. For example, two-year colleges talk about the problem that they are unable to bring students onto campus after they're done with classes. And that makes it really hard for them to do programming that would address this problem. And then there's a tradition that we talked about earlier. There are a lot of events in colleges when alumni come back to colleges. They want to see that alcohol is expected to be part of some of these traditions. And then there are the challenges of off-campus availability. So there are off-campus house parties and friends that are an easy source of alcohol for students. We heard about neighborhoods with high density of alcohol outlets that also attract a lot of college students. Fake IDs are a big problem. They're easy to access. And there are sometimes problem outlets that colleges are dealing with that specifically target their messaging to students and their marketing to students. And when students come, they're not checking IDs. They're over-serving and causing problems. So let's talk about what works. This is a graphic to show the college alcohol systems model. So we all need to be a part of this problem, and this is one of the reasons why this Department of Health and Mental Hygiene has funded this project so that we can help colleges address this problem. Colleges can't address this alone. We all need to be a part of the solution. We need to address it at the individual level. We need to address it with high-risk students. We need to address it at the college level and at the community level. So our overall philosophy is that reducing college drinking is a shared responsibility, that we need to consistently enforce policies that are in place and have a consistent message that's being sent to students that alcohol is not a part of the expectation and that alcohol is not available to students under 21, that alcohol is not, excessive alcohol drinking is not acceptable. evidence-based programs and policies and practices, and a strategic plan. These are all things that we're going to be working on putting into place this year with colleges. So this is kind of a list of the ideal interventions for high-risk drinkers. So we talked about looking at individual interventions as well as environmental interventions. So we want to make sure that there's a way to identify high-risk students that's a comprehensive and uniform way of identifying who the high-risk students are. And then once those high-risk students have been identified, that there's a clear roadmap to follow once a problem has been found. And that there's training for key personnel, so we're talking about people in the counseling office and the residential halls, people who come in contact with students, and appropriate parental involvement, and a standardized method of measuring alcohol use and related problems. And in terms of the environment, these are some of our ideals for intervening in the alcohol environment. Alcohol is not an ordinary commodity. Alcohol marketing, we want to make sure that the marketing is addressed to adults and not to people who are underage. Alcohol pricing, we want to reduce any discounting so that a lot of times you'll see problems with happy hour discounts that attract students. Alcohol pricing should keep pace with inflation. And alcohol availability, that's something that can be addressed in a number of levels. We're talking about responsible beverage service, making sure that outlets are training their servers to make sure that they're checking for IDs and not serving people underage or not over-serving. Making sure that alcohol outlet density is addressed. And then alcohol promotions. Again, alcohol should be promoted only to adults and in a way that reflects the content of the beverage and not these lifestyle ads that make students get the impression that alcohol is something that everybody's doing and is over the top and excessive drinking is acceptable. So this is something, this is the Freedom Pyramid in action for alcohol. This shows, you can see at the top, the alcohol education and counseling, screening, and brief intervention. And then at the bottom are more of the environmental impacts that we've been talking about. So you can see that the smallest impact is at the top, and that's because those interventions are addressing the high-risk drinkers. And the largest impacts are the environmental strategies that we've been talking about, such as increasing alcohol excise taxes, reducing alcohol outlet density, restricting and reducing alcohol marketing. So for year 2, we are really excited to be starting our second year right now. After we've done a lot of talking with the colleges throughout Maryland, we're going to be doing a lot of work with colleges to provide training and technical assistance to make sure that we can implement some of the effective and best practices on more and more campuses in Maryland. So we're focusing on raising the profile of the problem, providing momentum and leadership. Again, we do have now 10 college presidents who have joined the College Collaborative. We're going to be providing public health expertise and support. So we're right now planning I'll talk a little bit later about the training and TA that we'll be providing. A forum for sharing and support. This is something that a lot of colleges said that they really are looking forward to, is a way for them to learn from each other. What have been their successes for other colleges that have similar demographics and size and face similar problems, and providing that kind of forum for sharing and support. This kind of a statewide effort is going to be able to attract more funding opportunities and, again, provide a kind of standard measurement tool. Because right now we don't have a standard measurement tool. Different colleges are collecting different kinds of data. It's really hard to compare from one college to another exactly the extent of the problem. So we will be providing training and technical assistance. We want to see the colleges that are part of this collaborative create a strategic plan so that they're going to be looking at all the data that they do have in their community and on their campuses, the extent of the problem, what policies they have in place, and where are some of the gaps, where are some of the places where they can introduce more evidence-based strategies. We're going to be providing TA on interventions, on evidence-based interventions and best practices, what kind of student alcohol policies different colleges could put into place, and creating a measurement system, again, so that all the colleges involved in this collaborative will have the ability to measure the level of alcohol use among their students. And that'll allow them not only to measure the effectiveness of their interventions, but the extent of their problem. If you're not measuring a problem, it makes it really hard to do anything about it. This just gives you a sense of some of the environmental strategies and best practices that we're hoping to focus on. Town-gown coalitions are really important. Again, because colleges can't address this alone, it's not a college problem, it's a community problem, and it's a statewide problem. So colleges will be working, and a number of colleges in the state are already working in coalitions. And we're hoping that more will be able to do that, and we'll be hoping to provide additional resources to the coalitions that do exist. So those town-gown community coalitions will be able to address a lot of the problems in the community. Promotions, including prices on and off campus. So we're also going to be looking at proactive enforcement of alcohol laws. Right now, a lot of times the alcohol laws are not enforced proactively or on a consistent basis. And enforcement of those laws sends a message that the community is taking this seriously. And this is an idea of some of the best practices for individual strategies. A system of screening and brief intervention to identify the high-risk drinkers. Cognitive behavioral therapy is one of the best practices for addressing high-risk drinking, and a strategy to work with parents, to get the parents involved in giving a consistent message to their students. We're going to be providing a web-based resource for parents and students. This is something that will be available so that each college will have it branded with their college name on it. This will be a resource that parents can go to for advice on how to talk with their students about drinking, and students will also be able to go to this resource for advice and support. So I want to close just thinking about the college student. When we talk about the college student and student drinking, we all know students who are going into college. And they go into college with all these hopes and dreams for where they're going to be when they come out. And alcohol has a way of interfering with a lot of those dreams. And we saw that earlier in the presentation. And if we want to do something to help our students make the most of their college years, we all need to be involved, the student, the community, the parents, and the campus. And multi-level approaches are necessary. So parent training, universal screening, clear enforced policies, reduced environmental, and that's what we have. So I am now going to turn it over to Jesse Ketterman, Dr. Jesse Ketterman from Frostburg State University, who is going to join us, and he's going to talk about what Frostburg State University has been able to do to reduce college drinking on their campus. When I first started talking to colleges in Maryland, everybody told me I need to talk to Frostburg because they're such a success story. So we're really pleased to have Dr. Ketterman be able to join us today. Are you there?
Thank you, Molly.
Okay, sure.
And it is an honor to be presenting with you today, and a huge thank you to Johns Hopkins for hosting the event. The audience is actually probably lucky that I'm not there in person because I can be a little intimidating, so I hope you enjoyed the conversation. We don't run into any technical issues as I present from Frostburg State University. As we switch over to my slideshow, and we can advance to the next slide, in addition to all those issues that Molly shared with us as to why we need to address this, you can see here this is some information that was shared with at a research summit hosted by EverFi, where you can see that today's student, they're drinking more alcohol than they actually are studying. And it just reiterates the importance of us coming up with comprehensive strategies on our campuses to address this issue. So as you move forward to the next slide, you can see at Frostburg State University in 2006, when Dr. Gibraltar came on board, he created an alcohol task force. And that was a task force that was open to faculty, staff, and students at the university. It was open to our local law enforcement agencies, as well as members of our community. And when we first started this initiative, that was the group. We didn't have all of these initiatives that I mentioned on the screen. We have had our SAFE office, which is a grant funded by our Alcohol and Drug Abuse Administration, and they focus on peer education and our social norming efforts. And over the years, since 2006, we've adapted several other strategies to include the National College Health Improvement Project, where we implemented strategies as part of that initiative. We're one of, I believe, 32 schools working with that out of Dartmouth. We have the Maryland Strategic Alcohol Collaborative, and that's what Molly had mentioned. We started working last year with the Maryland Strategic Prevention Framework, and that has given us some funds to implement strategies not only at the college level, but look at our community issues as well as at the high school level. And I'll share a little bit more about that in the slides ahead. And where we just finished up our second year with an NCAA Choices grant that allowed us to do some late-night programming, as well as identify some strategies among athletes, which is a high-risk population on college campuses. Our strategies, we look at individual strategies, environmental strategies, and system strategies. And as you can see on this slide, we look at prevention, engagement, and deterrence. And we've actually, we're in the middle of our summer orientation programs for our incoming students. And just to share how this prevention, engagement, deterrence model fits in, currently this summer we have students complete Alcohol EDU, a program by EverFi. It's a population intervention strategy, and students are expected to do that before they come to Frostburg State University. In terms of engagement, Dr. Gibraltar has a conversation with our parents when they come up here for the summer orientation programs. We are able this year to give them a resource called a Parent Handbook, talking with college students about alcohol. That was produced by Rob Terussi from Penn State University. And then when you look at deterrence, we let students know up front. Myself and the associate dean have a conversation with students during the summer orientation program. Hey, we do address issues and citations that occur in the local community. So up front that we're going to be out there, we're going to be involved, and we want you to make responsible decisions. And most of all, you got to remember why you're here at college, and that is to get your college degree. So one of the things that we did as we started with the National College Health Improvement Project was establish an aim statement. And this kind of gave us direction of where we're trying to go. And you can see this on the next slide. Our aim statement is Frostburg State University will establish a culture that actively supports, educates, and empowers students to make healthy choices about alcohol consumption. And you can see that in the 2009 core survey, our binge drinking rate was 43%. We want to reduce that by 25% to a rate of 32% when we do the core survey in 2015, and I'm going to share in another slide where we're at with those efforts. The next slide talks about our current initiatives, and I'll just kind of to do an overview of some of those initiatives to give you an idea. We do basic screening that's provided by our counseling center, so as we have high-risk drinkers, we want to get them to appropriate resources and services. I mentioned Alcohol EDU. That's a program that all of our freshman students are required. We've also established some other presentations that we do for our student population, Making It Count, and that really is an in-person clicker presentation where we give students instant feedback about perceptions of consumption versus actual numbers that we have. We have tips for the university that we provide for our Greek organizations and other any group on campus that's interested in getting involved and being trained through the TIPS program. We provide late-night programming through our Student and Community Involvement Office. You can see we have a Berg Peer Education Network. And, when you talked about identifying high-risk drinkers, students that are come through our student conduct process, we do an initial screening with them to get an idea if they are high-risk drinkers or not. And if they are high-risk drinkers, then we refer them to our counseling programs and do that basics intervention. So those are some of our individual strategies. And then as you look at this from an environmental point of view, we engage in both social marketing and norming campaigns, and I'm going to share some of our social marketing slides. I'm going to share with you a GIS blotting system that allows us to kind of identify where our potential problematic houses are, and then also provide parents and students with information about making good decisions when they identify housing off campus. We offer substance-free housing. We have a Safe Ride program that's designed to provide students with a safe ride home if they're out in town and need a ride back to campus. We do engage our property managers. We have an off-campus housing fair every spring. There's really about 3 or 4 major property managers in campus, and we're in regular contact with them, and that allows us, if we're able to identify a problematic house, then we can reach out to that property manager and become partners with them to try to work with those students to change their behavior. Again, we look at intervention strategies for specific groups. I mentioned some of the freshman aspects. Athletes, we reach out in the fall to our athletes and do different types of programming, whether it be the making account presentation, whether it be the one bystander intervention program that we've developed, or whether we do, and we kind of rotate these because we know that athletes are going to be around for several years. We also do some sexual assault education within that population. So we have a great partnership with our athletic teams here at Frostburg. And the same, another high-risk group would be our Greek life population. And so I mentioned we do tips training there. We go out to fraternities and sororities and talk to them. And we also engage them in our late-night programming so that, again, they understand that there's another aspect to campus life. And our Greek organizations on campus do a wonderful job in terms of community service and community involvement, and so we engage them as well. And then when you look at some of our system strategies, our dean of our College of Business has been an outstanding partner with us over the last several years to increase the number of Friday courses offered in that area, and those efforts are starting to work out now that we're reaching out to the other colleges and seeing some increase in Friday courses in those areas. And we know that from the data that we've collected from our College of Businesses, if we can have more Friday morning classes, that deters drinking on Thursday nights, and that's one of our problem areas here at Frostburg. And we have established 2 years ago what we call joint jurisdiction. So our university police officers who are sworn officers can now actually engage in issuing citations in the community right around campus, in addition to our Frostburg City police officers. So prior to that, having that agreement, what occurred was if our university police were driving through the student neighborhood and saw someone, walking down the street with a cup of beer, they couldn't issue a citation. All they could do at that point was call the city police and have them come out. Or if the city police called our officers into their jurisdiction, they were allowed to issue citations. But now we have a partnership where our police can actively patrol those areas off campus. So as you move to the next slide, part of our work with the NCHIP, the National College Health Improvement Project, is we implemented a strategy. What we do is look at individual strategies and apply what we call a PDSA model, and it's Plan, Do, Study, Act. It's based off of some of Deming's work that has kind of been modified and adapted over the years and implemented in the public health arena. So we kind of come up with the strategy, implement it, study the results, and then decide, do we need to make more changes to it? It wasn't effective when we didn't get any results. And so right now on our campus, we have probably around 21 strategies that we've implemented, and right now we're still continuing to implement 10 to 15 of those. So we'll implement a strategy, get feedback about it, and then decide whether we want to continue that strategy, whether it was effective for us or not. And some of those strategies, you look at social norming, social messaging, the alcohol program that I mentioned earlier, We assess the impact of when we screen our conduct violators and run them through our basics program, and again, all these initiatives that we have a PDSA model applied to that, and so we're always collecting data and making our decisions based upon the data that we collect. So I've shared, two of those PDSAs. So if you go to the next slide, you'll see this is the data. What we wanted to do when we entered into the new jurisdiction, what we did was in the spring we said, are the students really seeing a difference in the number of patrols, or did it not make a difference? Are they not seeing more police officers? So when we implemented this in spring 2012, we had an event where we surveyed students, and as you can see in that slide, with the black bar graph, the number of patrols, students did notice an increase of patrols between the fall and spring. Another PDSA that I, again, remember that there's about 10 to 15 of these PDSAs currently in implementation, but another example is this GIS Mapping program that we have, and this was a joint effort between the Associate Dean here at Frostburg and the City of Frostburg and the Code Enforcement Office. But what you can see is there's two sides to this screen. On the left-hand side it'll show you where citations are being issued. And then on the right-hand side, it shows you information about rental properties. So the picture on the right shows you the property itself, when it was built, when the last inspection occurred, and then on the left, it shows you where violations have occurred. So this strategy, this PDSA is not fully implemented yet, because as you can imagine, there's a lot of data that we need to upload to get this fully operational. But it will give individuals an idea of, are there problematic areas where citations are being issued, and then on the other hand, it provides information about rental units in Frostburg. So we're hoping to continue to develop this and make this live so that it is out there for our students and our parents, as well as for our law enforcement. As you look at the next slide, I said I would share with you some of the messaging that we've done on campus. So you can see back during Halloween, we created a social marketing flyer. Nobody likes a sloppy zombie, because zombie seems to be a big thing amongst our students right now, and that it includes some low risk strategies. We acknowledge that students are going to drink, and so that we know if they're going to drink, let's discuss low risk strategies with them. On the right hand side is a flyer that we created, and like any town we deal with, we have an event called the Shamrock Shuffle. It's kind of a event around St. Patty's Day. One of the concerns that occurred 2 years ago with the event was the number of citations for people walking with open containers. So we wanted to kind of market around this issue, and we created a poster that would discourage that at the establishments. Another poster that we created at one point in time, we deal with an issue up here called jungle juice, and depending upon what party you go to, some parties it's mixed with vodka, some parties it's mixed with grain alcohol. But we created posters to educate students about the amount of alcohol they were consuming if they were drinking this jungle juice, and if it was contained grain alcohol compared to having a beer. And so we tried to reduce risk in that way. The next slide contains a message about an email that we sent to our students. And we try to do messaging about once a month to our students, making them aware that we are addressing issues in the community. We talk about, again, responsible consumption if they're going to engage in such. So I'll leave the slide up for a minute. Basically, this is the one that we shared at the beginning of the semester. We hope your semester is off to a great start. I'd like to take a very brief moment to remind you to enjoy this great time in your life. As you attend classes, study, and connect with new and old friends, be mindful of the choices you make. They can have a significant impact on your future. Here are some quick tips. And 1 out of 3 FSU students aren't consuming alcohol regularly. Not everyone's doing it. All the way down to, in spite of recent development in other states, marijuana remains a criminal violation in Maryland. So that's another issue that we're trying to deal with and address. And then there's also a bullet there that talks about if you're cited off campus, you'll meet with an administrator on campus. So that's kind of an example of some of the PDSAs that we've implemented at Frostburg. And again, if I shared all of them with you, I think that would be a webinar in and of itself. The other major initiative that I work directly with is our Community Coalition. And so if you can advance me to the next slide, the goals of our Community Coalition is to decrease underage drinking in the Frostburg community. So that includes, the high school, the local residents, as well as college students, and decrease young adult binge drinking. So really what we've done with our Community Coalition, and it represents the local high school parents, high school students, college students, religious organizations, media, our liquor control board, our city administrators. So there's a lot of people that have joined the membership of our Community Coalition, and that includes the local bars themselves. And we've partnered with them in different ways, and I'm going to share a little bit about that here shortly. And you can see what we're trying to do is we looked at 4 areas: social community norms, social availability, enforcement and adjudication, and retail availability. And so under social and community norms, we've implemented strategies like the high school level Parents Who Host the Most Lose the Most campaign. We offer a Mad Power Parents workshop. Some of these strategies overlap with some of the other things that we've done through our NCHIP initiative, but for example, revising our student disciplinary sanctions to identify high-risk drinkers. Under social availability, that looks at our media campaigns, and again, we've developed campaigns for our high school environment as well as our high school environment. Under enforcement and adjudication, we have a tip hotline. We have what we call party patrols, and basically once we identify a high-risk property, if a property has received more than 3 citations for noise, our police officers will go out and do what we call a knock and talk to them about responsible expectations of living in the community. We fund saturation patrols both with the city and university police, and we get involved even with local events at the high school. Under retail availability, we have a cooperating alcohol agreement, so we've partnered with our local bars, and what we say is we'll provide you with free trips training as long as you agree that those individuals are going to be working on Thursday, Friday, and Saturday nights. We've also done things with the agreement that include we'll help them create a little, let's say, appetizer menu, and then on the back of the appetizer menu we'll include low-risk strategies. We also, through our retail availability, we fund compliance checks. I think this past year that the sheriff's office completed 10 different rounds throughout the year for compliance checks. So that's an example of some of the work that's being done within our Community Coalition level, and that's through the Maryland Strategic Prevention Framework. My next slide is an example of one of those slides that we did with around the event that we have. Is called a Shamrock Shuffle, and what we're trying to do is get people to understand, hey, don't urinate in public because there's fines associated with it. So I thought people would enjoy that and included that in the slide. As we move on to our next slide, even though we have a number of initiatives, we still have challenges. And some of those challenges include that, we have this culture of drinking on college campuses. Every year, we have a new set of freshman students. So we're always educating them, on what happens in college life, what you need to be prepared for, that you should be making responsible decisions. We also deal with that perception of a lack of consequences. Students think that they're coming to college and all of a sudden they have this freedom and there's no responsibility that goes along with this freedom. So they don't realize, hey, if you get a citation in town, you're going to go to the local court system. You're also going to meet with the university official, but they don't kind of want to acknowledge that because they feel that they're still in this untouchable stage of their life. Mentioned with the high intoxication rate of students consuming grain alcohol, and I mentioned, I talked as I speak to the freshmen here. I say, one of our biggest risks is petite young ladies, because they'll come up here in the fall and they're going to go to a party on a Friday night. And when they do so, they're going to get this cup and they're going to drink this jungle juice that has its own risks associated with it, drinking out of an open container like that. But it may be mixed with vodka that night. And they're going to drink 3 cups of this. And as we all know, vodka is about 80 proof. The next night, they'll go to a party and they're drinking this fruit punch mixed with grain alcohol. Well, now we're at 190 proof. So they drink the same 3 drinks, but they're almost 3 times as drunk. And then, we have to address dealing with the medical piece. Anytime a student is transported and we're aware of it, we do contact the parents the next day. So we engage the student and the parent to make better decisions in the future right off the bat. Just like any campus, again, we have entrepreneurial students who try to engage in having parties and collecting money, so we have to continue to address that issue. And then we also deal with low-cost drink specials. So when you look at Frostburg, some of our lessons learned, which is the next slide, we are fortunate that we have a president who is providing us with leadership on this issue. And I can't say enough, leadership is key. Although there's a lot of work that's done within our alcohol task force, our president is involved. He attends our meetings. He provides us with direction, and again, wants us to continue to expand our efforts. We talk about our team, and our team represents a number of individuals on campus, and you can see we have on the slide there, achievers, collaborators, activators. Those are all strengths out of the Strengths Quest, if you're familiar with that. But we do want to make sure that we bring different talents to the table. We're always looking at research. I mentioned earlier that we shared this parent handbook talking with college students about alcohol. We were introduced to that at our Maryland Collaborative meeting at the beginning of May. We modified it to meet Frostburg. We're handing it out to our parents. And then so what we'll do in our PDSA model is sometime in the middle to end of July, we'll send an email to parents say, hey, do you recall receiving this brochure? If you did you read it? Did you get anything out of it? So that's how we'll kind of assess that, see if that was effective for us. Again, college is a unique environment. We have our challenges that go along with that. The rapid cycle, I've kind of touched on this throughout the presentation. This does take financial resources, and if you remember the third slide that I shared and all those initiatives, we just started with an alcohol task force, and through that alcohol task force, we were able to reach out and develop these partnerships and receive some additional grants. But it does take money to implement late-night activities, programs, to create these partnerships, to do the saturation patrol. So there has to be financial resources associated with it. And the other piece there, addressing binge drinking and comprehensive strategy. There's not one magic bullet that's going to solve this issue, or else we would have fixed it 30 years ago. And so you always have to look at your own campus. What is going to work at your own campus? What is effective? And who is willing to work with you at this point? Because, again, we didn't start with working with our local liquor establishment, but we worked to that point. So be in it for the long haul and know that partnerships will evolve as you kind of continue to work on this issue and bring light to the concerns that you have. And that goes to the last slide there, perseverance, persistence, and patience. So what I wanted to share is some of the data that we've collected and some of the instruments that we use here at Frostburg. We do the core survey every 3 years. We also conduct the National College Health Association assessment every 3 years, and we stagger those two on different years. Our freshman students complete the Alcohol EDU program that has some built-in assessments, and so we also receive feedback annually about the data that's collected through Alcohol EDU. We look at our conduct statistics both on and off campus to give us an idea of what's going on. We assess our medical transports to see what's happening, and then all these strategies that I mentioned earlier have built-in assessments with them. So we're always collecting data and trying to improve and make sure that we are implementing the most effective strategies on our campus. When you look at the results through our core survey, you can see in 2006 our binge drinking rate was 54%. That is reduced now to 41%, so we have made some strides. We're still trying to do so. You can see back in 2006 when it was 54%, we were well above the national average, and now we are below the national average. So the national average has kind of remained the same, around 43%, and we're right now at 41%. And we look forward as we go into 2015 to see how much further we've been able to make strides in reducing our binge drinking rate. The next slide I've shared with you is our NCHIP monthly reporting. So every month we send a survey out to 500 random students, and basically this just validates some of the other information we collect with the core survey. So you can see the binge drinking rate kind of varies month to month a little bit, but when you look at it on average, when we did the core survey in 2012, it was 41%. If you average our NCHIP data, it's 41%. So, our measures are giving us similar results in terms of the outcome. Through our monthly binge, our NCHIP monthly reporting, we also look at harm-related data, and we also infuse questions when we're looking for information. So at one point, we wanted to get a better idea of what kind of consuming was going on. Are students drinking more beer? Are they drinking more shots? Are they drinking this fruit punch? So we try to keep that survey to about 3 or 4 questions, but we also do so with the intent of collecting additional data as we need to. And the next slide just shares with you some of the different initiatives that we have. Our partnership with EverFi, the Maryland Strategic Prevention Framework. We still need to add our graphic representation for the Maryland Collaborative. So I hope this is, Molly's going to send me something here soon so we can add that to our mix. But you can see the different partnerships that we have around this issue. And so this takes us to our next slide, and this is where it ends. It's really about the students and creating a responsible and safe environment for our student population. With the goal being my last slide is we don't want them to sidetrack their goals, and we want them to graduate from college. And if all goes well, we want them to do that in 4 years. And this is another one of our social marketing campaigns that we had a billboard coming up into Frostburg, and we had that posted around the high school graduation and our college graduation. So it was a message that applied to both markets that we're trying to deal with here. So with that, I'm going to turn it back to the folks downstate at Johns Hopkins, Bloomberg School of Health.
Thank you very much to both of our speakers. We're going to be taking questions now for both speakers. And for people watching online, if you click on the link on the screen, you can send emailed questions or email directly to maphtc@jhsph.edu. For people in the live audience, please wait until we can bring you a microphone so that the people watching online can hear your questions. So I'm going to get started with a question that has come in online, which is for both speakers. Maybe we'll let Molly answer first, and then Jesse, you can come on. Which works better, the carrot approach or the stick approach?
Oh, that's kind of the $6 million question. I think what we're really using is well, I'm not sure exactly what they're referring to, but I think what we're doing with the collaborative is really using the carrot approach in terms of we're really offering colleges a lot of resources to step up and be a part of addressing this problem in a more comprehensive way and use some of the resources that we're able to bring with training and technical assistance with the measurement tool. And maybe they're talking about in terms of reducing students and excessive drinking, in which case it's a combination, like we talked about, of increased enforcement as well as addressing individual high-risk students. So I don't know if you have anything to add, Jesse.
No, I would agree. I think it's a combination in that, for example, when we talk about our late-night activities, we have some pretty hefty incentives to get students there. And again, that's one, to get them there, and two, to discourage them from going out to some of these local parties where they would engage in some high-risk behavior. So when you look at our strategies, again, it's prevention, engagement, and deterrence, and I think to do that, you have to have the carrot and the stick.
Okay, thank you. Here's another question from online. Have you studied different drinking patterns and developed different messages or strategies targeted at females versus males? And I guess this would again be for both of you.
Yeah, I really can't think of any strategies that would be specific to either, girls or boys or males or females. I don't know if you are aware of any, Jesse, or if you've used any.
Well, I invite the audience to go to our website and search for Reality Check. We have a Reality Check website, and that most of our social marketing efforts, are on that website, and you can see how we do, again, create messages for various audiences, and maybe, some of it. We have messaging that we do specific to athletes. We have messages that go towards females, towards males. So if you go to our website, you'll see how we've done that, and again tried to create certain messages to certain markets.
Okay, thank you. Any questions now from the live audience? Okay, we'll give you a little more time and go back online. There was a question about using peer leaders or educators for doing some of the education around drinking, specifically for the programs for Greek life, winning support from a core group of people in Greek life or in other student groups. And I guess that, again, can be delivered to both.
The question was?
Whether you've evaluated the use of peers or had, is that a targeted kind of program?
Yeah. I know that there are a lot of peer education programs that are being used both with programs in Greek life. It's often used for students who are found to have an alcohol violation to work with peer educators. I think it's a promising program. It's not one of the highly effective programs, but it is something that what we're really focusing on this year is for colleges to use a multi-level multi-component approach to reducing college drinking. So not just targeting any one program, but addressing using as many different kinds of programs at different levels and engaging as many different people in the community, on campus and in the community as possible.
Jesse, do you have anything to add to that?
Absolutely. We do have a student group here on our campus called the Berg Peer Education Network, and they conduct activities. They go out and do workshops, and they're affiliated with Bacchus and Gamma. And so they've, presented these programs nationally and have received some recognition there. But we do engage students again, and those students commit to making healthy decisions right off the bat. We also, through our alcohol task force, we want to make sure that we have a representative from Greek life, the student population, at those meetings, because we know, again, that they're a high-risk population, the same with athletes. We want them involved and engaged. And so, as we look at our initiatives, we have to say we have to reach out to students. If we can't get our students to buy in, and I facilitate the Tips to the University. I'm one of the people that provide the Tips to the University workshops on campus, and that's what I tell them. Students, I'm not out at midnight. I'm not out at 2 in the morning. I need you to be the eyes. I need you to look out for the other members of your campus community. And so, if you can't engage the students, if you can't get them involved, I think you're going to have a hard time making significant change on your campus.
Thank you. This is another question for you, Jesse. How important is the support of senior administration to the effectiveness of efforts? And what happens when the support isn't forthcoming?
Right. I guess all I can add is that we are very fortunate that we have Dr. Gibraltar here, who does see this issue as very important on college campuses. And the message that he continues to share to our students is, you know what, I'm concerned about your safety, and I don't want to have to make a call to your parents that, again, something happened to their son or daughter. And so that has been his approach from the very beginning, is he wants students to be safe, be responsible, and that support is really, spurred our involvement and our activity and our efforts around this issue.
Okay. Here's a question for online for Molly. Does education in young people change their behavior?
Education alone is not going to be effective in changing young people's behavior. We know, again, from a lot of the neurological research that's been done in how the brain develops, that young people's brains are really kind of geared toward searching out high-risk environments. And so education alone is not going to have an impact. Education can be part of a comprehensive strategy that's going to include working to address environmental risks and working to reduce individual risks. But it's one part of a comprehensive, multi-level, multi-component program.
Jesse, did you want to add anything to that?
Well, I would add that students are at and go through different developmental stages throughout their college career. And one of the things is you look at your intervention strategies on your campuses. I mentioned we have our freshman students come in and complete alcohol EDU. What are we doing for sophomores, juniors, and seniors? You just can't look at this and say this is a one-time intervention strategy. And so, as you look at that, you have to look at how do we market and engage students over the 4 years. And this applies not only to the alcohol issue, but as you talk about addressing sexual assault on campus and bystander intervention, all these topics need to be reiterated year after year so that students, again, keep that information in the front of their mind, and when they're participating in behaviors, they're thinking about those things.
Thank you. Any questions from the audience, the live audience? Okay. We've reached the end of our questions, and I just want to really thank you, Molly, for coming back to the Mid-Atlantic Public Health Training Center. And Jesse, I'm glad that we were able to successfully have you participate from Frostburg. And we look forward to having you back again next year when you have more to report about what works. Thank you.
Okay, great. Thank you.
Thank you.